So this is a very important concept, that what is the difference between the arterial blood gas analysis and the venous blood gas analysis. We know that for the arterial blood gas analysis, we take the sample from the arterial line, and for venous, we take it from the venous line. But which to prefer? This is an important question. So in cases where you need to know the oxygen saturation, the oxygen concentration, the partial pressure of oxygen, the true partial pressure, then you go for arterial blood gas analysis. But for all other things where there is no respiratory issue exist, you can go for venous blood sampling. Arterial blood gas sampling is always the gold standard because it will provide you the direct measurement of partial pressure of oxygen. It is invasive and it is more painful procedure because for that you need to accurately localize the arterial lines or the vessels. Therefore, it's a time-consuming process. In comparison to that, the venous blood sampling is easier, it is safer, and it is used for the routine sampling. It is a very good screening tool. The next thing you need to know is what is the difference between the values of the pH, CO2, oxygen in ABGs and VBGs. So if you look at the pH, difference between the VBGs and the ABGs, then the pH is slightly lower, that is 0.03 in the venous blood sample. The reason is that presence of more CO2. The CO2 level is typically higher in the venous blood sampling than the arterial blood sampling, and the value is about 5 to 9 millimeter of mercury. But keep in mind, this is not the accurate way of assessing the CO2 level. But what VBG can tell you, it can help you to rule out the hypercapnia. For example, if the CO2 level is less than 45 millimeter of mercury in the VBG sample, that will rule out hypercapnia. The next thing is the oxygen saturation, concentration, or partial pressure. We know the venous blood contains less oxygen as compared to arterial blood. Therefore, the oxygen concentration, the oxygen partial pressure within the venous blood is less reflective of actual level of oxygenation. You can use the pulse oximeter if you are using venous blood sampling. The reason is that the venous blood sampling along with the oxygen saturation will provide you nearly an accurate assessment as the ABG does. So the practical approach is that for the initial screening, you use VBG along with the oxygen saturation checked by the pulse oximeter. But if patient is having severe critical illness or any complex scenario where you might think that oxygen concentration is required, the actual concentration is different what the pulse oximeter is showing, then you go for ABGs.